Okay, sorry. There is some clash with another meeting. Can you hear me?
Yes,
Yes, doctor.
Okay, so please, medicine is a simple way to get forgive and acceptance from Allah. So try to concentrate in it. Just try to think for every patient. He is a lesson for you. Is it meningitis? Is it encephalitis? How can it differentiate? What can be the difference in investigation or in treatment like that? Is it status epilepticus or not? Is it, what can be the other causes? So every case you must asking yourself, discussing, and try to live with medicine for some time. Okay. I think now we need to finish soon because there is another meeting. Can we start by Oski?
Can doctor wait?
Okay. We cannot hear you.
Mani, we cannot hear you.
So who can answer?
I try to answer that.
Yes, please.
This is spastic quadriplegia, and like you see, the posture is like scissoring. So the diagnosis be cerebral palsy.
Okay. So it is very important to know that cerebral palsy, we have a lot of spot diagnosis can go by observation, please. Don't underestimate it. She is special, she is not oriented, she has this position, she has abnormal of the hands, abnormalities of the feet, and scissoring, all that is very important. Okay, sometimes she is wearing, still wearing pampers or diaper. It is very important to notice all that. What about if she has nasogastric or orogastric tube also? Okay, second slide, please.
Okay, sorry. I can't find the microphone. Wait. Okay. This is the second slide. So can Abi answer this?
Mani, can you make it slideshow bigger?
Nampak ke ni? Aku tak tahu. Okay. Aku tak tahu macam mana. Okay, can Abi answer this?
So describe the image.
Increase the volume, please.
There is, so this is a CT scan of in axial view. So we can see there is a
Hypo.
there is hypodense lesion located at the frontal. So there is so I think this is an abscess or any space occupant lesion like tumor or abscess. So we can see there is a midline shift. So they shifted it shift the midline to the left side. And we can see surrounding there is edema, cerebral edema surrounding the lesion. And diagnosis, so I can maybe this is a brain abscess. So the causative organism might be streptococcus.
Other differential diagnosis.
The differential diagnosis such as primary brain tumor.
Any parasitic infestation can do like that?
Others.
Parasitic.
Parasitic, yes. Parasitic infection. Like hydatid cyst.
Yes.
And
So you must consider it is very important. So thank you. The most important here is to ask yourself, is it CT or MRI? And if MRI, it is T1 or T2. Okay. And you must know that you are the position of the patient. It looks like us. If in front, so the right is right and the left is left. So you must be able to say where is it, because it will give neurological sign according to the position. Okay. So any comment from the presenter? Because we have few minutes to finish, please.
I think what ABC is true, which is this picture is a CT scan of the brain. So showing there is a hypodense lesions at the frontal area. We can see there is a midline shift of the midline shift, and also the compressions at the ventricle area. So the diagnosis is brain abscess, and causative organism is a streptococcus species with Streptococcus pneumonia. But other organisms also can be Staphylococcus aureus. Okay, we can proceed to the next slide. Can Rahil answer this? Rahil?
Hello, can you hear me?
Yes.
Okay. So I think this is a state of severe hyperextension, and there's also spasticity at the head, neck, and spinal of the child, which causing the child to look like in arching position. So this is of his tetanus posture.
And the differential diagnosis?
Differential diagnosis could be patient with cerebral palsy, or children that has infected with meningitis or tetanus infection. That's all that I can say.
Okay, what Rahil said is true. So the posture, you can see the obvious one is opisthottonous position. So there will be hyperextended limbs, and also the differential diagnosis is what Rahil said is correct. First one is can be cerebral palsy, spastic CP, any infections that can causes the posture. And also tetanus infection. Okay.
What else?
So,
what else? Severe neonatal jaundice.
Oh, can cause kernicterus?
Yes, very important. This is related to our subspecialty. So take care about that, please. If you find any baby crying by peevish cry, or started to get this abnormal posture, it is very ominous sign. Don't forget it, please. Okay. Thanks.
Okay,
Next
we
slide.
proceed to the next slide. So, 18 months old girl presented with a jerking and stiffness movement for 20 minutes. It was accepted with fever. So, can Idlan answer this one? What is the diagnosis and also difference between simple and complex febrile fit?
So my diagnosis will be febrile fit, febrile seizure.
The difference between
So the difference
only
between simple and complex febrile seizure for duration. For simple usually is less than 50 minutes. For complex, more than 50 minutes. And then the simple usually seizure come with generalized seizure. However, for the complex, usually focal features. And that's it.
okay. So the diagnosis is true febrile seizures. So to be specific, with the time, so we can say complex febrile seizures, but need to look for the features of the jerky and stiffness. So, so the difference between simple and complex febrile fit is first is based on time. More than 50 minutes is for complex. Less than 50 minutes is for simple. And also, generalized seizure is for simple, and focal seizure is for complex. And
Another important point, the post-convulsive neurological deficit, like Tod's paralysis or like that, it will go with complex.
yes.
Next slide, please.
So can Nadia answer this question?
This is lorazepam, which is and it usually used for anxiety, and the side effect it can cause sleepiness and dizziness, as well as benzodiazepine have a high dependent effect.
Yes, correct. So this drug also can be used in treating active seizure like status epilepticus, alcohol withdrawal, because this drug has a sedative hypnotic effect, right? Okay. So the next one, can Zer Ain answer this?
This is probably an atonic seizure.
Oh.
Based on the picture, it seems that the child suddenly fall and have weakness of the limbs. Okay.
Yes.
Possible signs of seizure. Possible sign of atonic seizure, probably falling straight to the ground. Due to sudden loss of muscle tone.
Yes. Possible type of seizure could be atonic seizure, and for other possible signs of the seizure can be he might have drooping of the eyelids, like that. Okay, let's proceed. So can Haziq Hadidi answer this question? Haziq?
So the best position for patient that has seizure is the recovery position, which is the patient will lying on the lateral side of him. However, for the first aid for the seizure, I'm not sure. What is that?
Oh, okay. So the best position of the seizure is left lateral position. So it is because to prevent the tongue to protrude tongue posteriorly, so it may obstruct the airway. So the first aid procedure, there's a lot. So the first one is don't be panic, stay calm. Okay. And other need to time the seizure. Do not put anything on into the mouth. Okay. Okay, the last but not least. Can Shahira answer this question?
Okay, so basically, the name for this procedure is suction. And then why this procedure done in order to clear the airway secretion in this backbound child due to prevent the orthostatic pneumonia.
Why does this child? Oh, okay. Already answered the second one, right? Okay. So the procedure is named oral suction. So why does this child need procedure? So maybe this child have bulbar problem, so bulbar palsy, and this to prevent the aspiration pneumonia, like that.
It's very important to consider pseudobulbar palsy. Okay, is it the last slide?
That's all.
Okay, that's fine. Thank you. Hoping, inshallah, we got some benefit from our teaching session today, and hoping we can see you, inshallah, soon in the hospital.
Inshallah.
Thank you. Assalamu alaikum wa rahmatullah. Because we have another meeting now.
Okay.
Thank you very much for.
Okay, thank you,
Thank you
Doctor.
very
Thank you
much.
so much, Doctor.
You're welcome. Assalamu alaikum.
Salam.
Salam.
Waalaikumsalam.